Hi, we are going to really quickly go through the different respiratory mechanics devices. I wanted you to be able to see these and have a reference for these up close. So you'll hear me talking about ideal body weight. Just remember that we will cover this in class and you'll see it again in lab. So for right now, you don't have to understand that if you're watching these videos before we've talked about this in class. So the first thing we're going to do is measure a tidal volume. So for that, we're going to need a Wright's respirometer. I'm going to show you these. These are two different versions of the same thing. So you can see here that they both measure exactly the same thing. They're both Wright's respirometers. They just look very different. On this one here, you can see there's white numbers and yellow numbers. The yellow numbers are our milliliters, and the white numbers are your liters. So you'll see that. And then here it's the opposite, where the larger numbers are your liters, if you can see those there. And then there's little tick marks next to the numbers, and those will be your, so the large numbers are your liters, and then this little bitty dial in the center here. So I'll show you on both of these so you can see the difference between the two. Just know that they're the same. They just look a little bit different when we measure them. So we're always going to use a bacteria filter with these because we don't want to contaminate our devices. These have a lock and a reset button on them. So we're always going to reset it and make sure that it's unlocked, so that way when the patient blows in it, the dial will move and we don't have to repeat this test. So this one has been reset and it's unlocked. So for a tidal volume, we instruct our patients to take a big or a normal breath in and blow out, and that's going to give us a value here. So if you'll just seal your lips tight, a normal breath in and blow it out. Okay, if you look closely here, you can see that this dial has moved. So we would say that that breath was 1.3 liters. So if we look closely here, you can see that this has moved up to the 1, and then the 0.3 on this little dial here has changed. So that's just simply a tidal volume. Whenever we're looking at tidal volumes, a normal tidal volume is 5 to 7 mLs per kilo of ideal body weight. So like I said, we'll look at the calculations for predicting normals in class, but this is just how to use this device. I'm also going to do a slow vital capacity. So for your slow vital capacity, we're going to put this in your mouth. Biggest, deepest breath you can. And then I want you to blow it out slowly until you feel like there's nothing left. So again, we're going to reset it so our dial goes back to 0. Seal your lips tight. Big deep breath in and then blow it out slow. Blow, 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 blow. Keep going, blow, 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 blow. Keep going till there's nothing left. Blow, 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 blow. All right. Okay, so that is a vital capacity. And on our slow vital capacity, it can actually be done two different ways. It can be done fast and slow, where we call it a forced vital capacity. That is not something we're going to do with this little device because it can't handle those speeds. So if you're measuring a vital capacity with this, we're always going to be doing a slow vital capacity. But our normal values for a vital capacity is about 70 mLs per kilo of ideal body weight. So if we zoom in and look at this one, you can see that the larger number and the smaller number, so our larger number is 1, 2, 3, 4, and our smaller number is, we're going to go back to the closest one, is 0.4. So that's 4.4 liters is her vital capacity. Okay, we can also do a minute ventilation, and I'm going to do that on this device so I can show you the other one. Our minute ventilation is where we simply have them breathe on this device for a full minute, and we want to count their respirations while they're doing it. So this one has an on and off valve here, so it slides on and off, and its reset is right here. reset it. Have you put your mouth in there. Okay, and then whenever you're ready, just slow deep breaths. Slow regular breaths. In and out, just normal breathing. Okay. Okay, so with this one, you can see this one is a little bit different. It records the, you're going to look at the big numbers first, so the yellow numbers. I know those are kind of blurry. So the yellow numbers are our liters, and then the white numbers on the inside are your milliliters. So our minute ventilation would be 6.4. Okay, so this is our MIP or NIF device where we measure our negative diaphragm strength, where we have the patient suck in, and we're going to measure how strong they can suck in, and this is measured in negative numbers. So if you look at this one, some of the devices are a little bit different, but if you look at this one, it only goes to negative 60. So healthy individuals, they very well may swing this red dial all the way up to negative 60, and so we would just say greater than negative 60. If it goes up to negative 120, then we can measure it up to negative 120. Just remember that normal individuals, we would say that negative 60 to 80 is normal. You may see in individuals who are athletic or singers or anybody that was normally using their lungs at a higher capacity than the everyday individual may have slightly inflated or slightly higher numbers than the average individual when we look at these. Okay, so for this one, you attach the mouthpiece, and then it has a little hole here where you put your finger over the hole. Now, obviously, I would be wearing gloves if I were doing this on an actual patient, but we're going to put our finger over the hole, or you can even instruct the patient to put their finger over the hole if they're with it enough to be able to do that. So what you're going to have them do is put their finger over the hole, suck in, and you're going to watch this dial move. So with this one, I want you to put that in your mouth. Take a big, slow, deep breath in. You're not actually going to get a breath, but I want you kind of like a milkshake through a straw. I'm going to see how strong you can suck. So whenever you're ready,
and you're going to cover the hole, right?
Yes. Put your finger over the hole and suck in. Good job. Okay, and this sometimes if the patient didn't understand, or if we're concerned maybe their effort wasn't that good, we may have them repeat it a few times. But obviously you can see here that we got upwards of negative 50, almost negative 60. So we're good. Okay, and then the last one here is a peak flow meter. So normally comes in a little box like this. We get our little device out. You see the numbers on the front of it here. And then there's this little yellow dial here. Whenever the patient blows out, that dial will move up, and that tells us how fast of a flow they generate whenever they exhale. So it's their peak flow. Normally we have them repeat this 3 times, and we take the best one, the best number out of the 3. And as far as predicted, with this one we normally say adults should be able, or females should be able to get at least 400 liters per second, and males should be able to get at least 500. But luckily in the box comes a little chart that it gives us predicted by years. So you go by the patient's age and then by their height. And so you also want to make sure when you're looking at this chart that you're looking at the chart for males versus the chart for females. So they're just slightly different, and it gives you a predicted value based on, again, their age and their height. These are a little bit fun to get in here. Okay. And then if this dial weren't already at the bottom, we shake it and it goes back down. But since we're already there, we're good to go. This one, I want you to seal your lips tight around that. Big deep breath in, and I want you to blast it out as hard as you can, like blowing out birthday candles. Okay? And you see that dial went up, and we take the number next to it, which in this case, we are exactly at 400. So for this, we would repeat it at least 2 more times, and we would take the highest number, and then we would reference that to what, based on her age and her height, her predicted should be. So that's just a simple walkthrough of these devices. We're going to show you these in the lab, but I wanted you to have a video for reference whenever you were looking at these at home. Thanks.